Hello, everybody. Since you are watching this presentation, I'm going to assume that you found it under the contents section of D2L. So bravo, well done. Remember, right, going forward, that's where the presentations will all be. And secondly, whatever device it is that you happen to be using now, anything that you have watched a YouTube video with, right? So whether smartphone, tablet, iPhone, laptop, whatever, right? Going forward, you'll be able to use any of those, devices or whatever it happens to be, right? So, if you were able to join the Zoom session for our regularly scheduled class, awesome. If not, right, there were a number of things that we had covered as far as the exam, some of the questions you had. So if you still have any questions that either weren't answered, and by the way, I will be, in case you didn't watch it, I will be placing the recording of that Zoom session on D2L as well, so you can go back to watch it. Just in case you have any questions that some other students had asked to get answered. So now getting on to the actual content, the actual meat, the stuff, the good stuff, right? Um, Here, right, the muscular system, right? I realize it's been almost 3 weeks since we've met, but the muscular system, right? When we think about the muscular system, when we think about moving the body, when we think about making a fist, when we think about jumping, when we think about walking, when we think about smiling, all of these different things are achieved via our muscular system, right? Some of the functions of the muscular system, which aren't quite so apparent, but yet are still unbelievably important, something such as the skeletal pump, right? I realize we have not covered cardiovascular system yet, and actually that won't be until 122. But when we talk about the skeletal muscle or something called the skeletal pump, that's one of the pumps or one of the mechanisms by which our skeletal muscles can actually help return the blood back to the heart. Right. This is why, again, people being sedentary for long periods of time, stewardesses or flight attendants or OR nurses, people who just stand for long periods of time, they are at a heightened or an increased risk of developing, for instance, DVTs or deep vein thromboses or basically blood clots in the leg. Right. And that's because the lack of movement, right, in the legs. When there's the lack of movement in the legs, the muscles themselves aren't swelling, right? Think about when you make a muscle, what happens? Well, you make a muscle and the muscle gets kind of big. Well, when it gets big, it compresses the vessels inside of that muscle and helps to push that blood further along the blood vessel, right? So in the venous system, it helps push that blood further or closer, closer to the heart. When we're not walking, we're not moving, when we're not using our leg muscles to any appreciable amount, that's when our blood becomes kind of static, meaning it kind of slows down. Things start to congeal and to coagulate, and that can stir up a whole slew of problems. Anyways, that whole thing will kind of you'll cover in 122 in the cardiovascular system. But really, by and large, when we look at the muscular system, we're really going to start to talk about kind of these large muscle groups, right? When we first start, and just by looking at this, this image here, we can see, right, up top, all the different facial muscles. On this image, they're much too small to really look at, so they're going to be broken out here in separate slides. But really, these are kind of some of the large muscle groups which are pointed out, some of the major muscle groups. So when we think about bending our elbow, or when we think about moving our arm, these are the muscles which are responsible for it. And this is the minority of muscles, right? There's not many muscles listed on here. I'm not going to count, but there might be 25 different muscles listed on this slide, right? There are hundreds of different muscles in the body, right? Most of them are small stabilizer muscles, right? They're not muscles which produce this huge amount of movement. However, they're just as important, right? So this next slide, here we go. Again, these are some of the major muscle groups of kind of the back, right? Of the posterior part, or of the dorsum of the back. We see the trapezius muscle, right, attaching up to the back of the back of the skull. right, and extending all the way down to the mid part of the thoracic spine, the gluteal muscles or the butt muscles, right? We're going to look at all of these individual muscle groups. Now, when we do that, we're going to talk about the function of these muscles, absolutely. And one of the ways to kind of figure out the function of the muscle is to look at the grain of the muscle, right? When you look at these muscles, they almost look like they have lines drawn throughout them. That means that particular muscle in that area, if you kind of think of that muscle shortening along that line, that's the movement it's going to produce. That's why it's important to kind of realize and think about, well, where the heck is it these muscles actually attached to? That's where a month ago, looking at the skeletal system, right, looking at the spinous process of the vertebrae, for instance, or looking at the greater trochanter of the femur, for instance, looking at all of these different skeletal structures, because that helped us figure out where the heck these muscles were going to attach to. So the first muscle, sorry, when I pause like that, just like in class, I'm taking a sip of my coffee because, man, it's just coffee. There's no need or reason to have it. It's just coffee. It's just there. So this muscle called splenius capitis, right? Capitis. All right, so it attaches to the skull, right? Basically along with the mastoid process of the temporal bone. Now, when we look at this muscle, again, when you look at the image on the right side, you can see kind of these lines going through the muscle. Now, this muscle is kind of like a butterfly shape, if you want to think of it like that. And this muscle is quite superficial, meaning it's not very deep, right? So this muscle, right, when we think about its function, when we think about what it does, this muscle doesn't necessarily always have to fire bilaterally. What I mean by that is, even though if you look, that muscle extends from the spine, right, again, the spine being here, right, that muscle extends off to the right, it also extends off to the left, right. This muscle does not only have to fire bilaterally, meaning this belly and this belly don't have to fire simultaneously. Just this side could fire, right? And the kind of motion that would dictate. Imagine if you were to kind of look up over top of your right, for instance, the right belly here, right? This would, if you're going to look up over top of your right shoulder, kind of up towards the ceiling, up over your right shoulder, that's the motion that this muscle would perform. Same thing with the left. This would look over the left shoulder. If both of these muscles would fire simultaneously, that's where the neck would actually extend, meaning that's where you would kind of look straight up overhead to look at the ceiling directly above you. Now, to see the muscle here, right, this is something called semispinalis capitis. You can see this muscle does not come off at an angle, right? Splenius capitis, you can see here and here, this is an angular muscle, right? Semispinalis capitis, you can see it's very kind of longitudinal, goes along the axis of the spine, right? So the motion it's going to perform is very different. Well, the motion that it performed can be very different, right? For instance, splenius capitis, you can look straight up towards the ceiling if both muscle bellies were to fire simultaneously, but if just one did, for instance, if it were the right side, you'd look up over top of the right shoulder. Semispinalis capitis, pretty much its only function is to extend the neck, right? Basically, you look up at the ceiling. Now, you can see semispinalis capitis here. We see it here, and we see it here. Right, but to get a really good image of it, we've got to remove a large part of, or excuse me, we had to remove the entirety of the splenius capitis, so that we remove that, and then we expose the bulk of the semispinalis capitis. Right. This image here is all the trapezius has also been removed right here as well. So a muscle called occipitalis. Now, when we think about the bone that this muscle overlies, right, the occiput or the occipital bone, right, that's the muscle, or that's the bone that this muscle overlies. Really, what this muscle is going to do is tense the scalp. Right, there's another muscle in the front called frontalis. We'll look at that in a second. There is, in some texts, you may see it called one muscle, occipitofrontalis. That is just basically the muscle being combined into one. Some texts have them as two distinct separate muscles. This one here is something called occipitalis. Again, that overlies the occipital bone. And this one here, this is something called frontalis. This overlies the frontal bone, right? If you kind of knock on your forehead, again, that is where if you knock on your forehead, that thin muscle there, that's the frontalis. Now, when you do that, when you kind of knock on your forehead, it doesn't feel like there's a heck of a lot of muscle there. Right? When you kind of push, it just feels like there's skin, and then there's just bone. That's how thin these muscles are, right? That's how thin the frontalis and that's how thin the occipitalis are. They aren't massively thick muscles. They don't need to be. All they're doing is tensing the scalp, right? Other thing with the frontalis is it can help to elevate the eyebrows, right? When you kind of think of someone just whatever told you something shocking, right? Someone said to you, "I love Dunkin' Donuts coffee." I find that shocking that anybody would ever find Dunkin' Donuts coffee delicious. If you like it, good for you, right? But where your eyebrows kind of raise up, right? That's the frontalis which achieves that. Now here's a muscle called levator scapulae. You can see, right? This muscle kind of comes up to the sides. Here, the splenius capitis. Again, this muscle here, splenius capitis, that's left intact. Semispinalis capitis, that's left intact. Here's levator scapulae. Right, it actually attaches to the transverse processes of the upper cervical spine, right, mid to upper cervical spine, and then it comes down and actually attaches to the root of the scapula, right. This is the muscle. Like if you were to kind of go in an area of kind of of your shoulder, right, kind of towards the back of the base of the neck. And that spot, you'll know exactly what I'm talking about. That spot in everybody, you kind of go up to like your sibling or someone that you, whatever, friend, a buddy. I did it to my sister all the time. I'd kind of go up and put my hands on her shoulder in those two little spots, just a couple inches off the side of the spine. Right, that's something called the root of the scapula or root of the spine of the scapula. Either one's fine. But there's this real kind of almost marble-sized spot, which is immensely tender and painful to kind of palpate or push on, right? And my sister, of course, I would just, push like a son of a gun on this thing. But the reason why it's so painful is because the levator scapulae muscle attaches directly to that spot on the scapula. And this muscle is tremendously worked, especially nowadays in our kind of current society, right? How much we now going online and remote learning, we're going to be using even more computer and stuff like that. But our current society with how much utilization of computers and technology, right? This is a muscle which, levator scapulae, elevates scapula. Oh, it elevates the scapula, right? And this muscle, right, when people talk about, oh man, if I sit at my desk too long or if I'm working at the computer, my neck gets super stiff. Well, yeah, this is the reason, this is one of the main contributors to that kind of neck stiffness and that neck tightness. It is the levator scapulae, right? Because think of it, if you're at a desk for any reasonable period of time, you have to support your shoulders. Well, this muscle elevates the scapula, which all of the shoulder muscles attach to. Well, the vast majority of shoulder muscles attach to, right? They all attach to the scapula, and this muscle elevates the scapula. And then this muscle attaches throughout the cervical spine. So yeah, right, this is a major contributor to kind of cervical or neck tightness. This muscle here, something called the sternocleidomastoid. Now, like with the occipital or the occipitalis, right, that overlied the occipital bone, right, with the frontalis, right, occipitalis you can see here, right, frontalis you can see here, right, they overlied the respective bone. The sternocleidomastoid, all right, sterno, all right, so if we look, right, from this particular image we can't really see, but if we look over here, right, sternum, All right, so there's right here's the top part of the sternum. You can't really see it. You can see it a little bit. Later on, we'll look at something called the jugular notch, right? But the sternum, right? This part of the sternocleidomastoid attaches to the sternum. Now you see a little kind of slit through here where gray starts to appear, or kind of brownish starts to appear. There's actually several heads to the sternocleidomastoid. I don't expect you to know the different heads, but just don't get confused and think, oh wait, I've got two separate muscles. No, you don't have two separate muscles. There are many muscles in the body that have multiple heads. Kind of the most well-known, right? The quadriceps femoris, or the quadriceps muscles, or our quads, right? Our biceps muscle, or our biceps brachii muscle. These all have multiple heads to them, right? The sternocleidomastoid, again, has multiple heads. There's the sternal head here, and then there's the clavicular head here. Right, the clavicular head attaches to the clavicle. I don't expect you to be able to discern, oh, clavicle, sternal head. Nope. This entire muscle, whether it's here, the entire muscle attaches, or excuse me, the entire muscle is called the sternocleidomastoid. Right here, you can't see the mastoid part, but on the lateral view, you can. Kind of just behind the ear, maybe, whatever, inch below, not even. Right. The mastoid process. Right here, temporal bone, right, the mastoid process. Right, so sternocleidomastoid muscle. So sternocleidomastoid muscle. Sometimes it's just kind of piecemealing what the actual muscle attaches to. Now, this muscle does a number of things. Again, if it were to fire unilaterally, meaning if it were to contract on only one side. Let's imagine if it were this left side. Yes, we're looking at this on the right. However, this is this person's left, right? So if the left sternocleidomastoid muscle were to contract, the head would, or the neck would flex and then rotate contralaterally, meaning it would rotate to the opposite side. So if the left sternocleidomastoid muscle contracts, the neck would flex down, and then you would actually turn the head to the right. Right. One of the things you can do is if you look into a mirror while you do this, you can actually see that muscle kind of pop out. Right. Same thing would happen on the right side, on the this cadaver's or this person's right side. Right. If this right sternocleidomastoid were to contract, the neck would flex down and then would rotate contralaterally or to the left. Bilaterally, if they were to contract, meaning both sides actually contract, what you would have is the neck itself would flex, right? Meaning the neck would actually bend down, but the head would extend. Right? So imagine somebody who just has like horrible posture, right? How they're kind of really just kind of bent forward, right? But their head still remains up, right? That's the sternocleidomastoid muscle kind of mimicking that motion. The neck flexes, so you bend the neck down, but then you take the head and kind of extend it upward so you can still look straight ahead, right? That's the actual motion the sternocleidomastoid muscle achieves if it's firing bilaterally. Now, another one of the kind of muscles of the face, or kind of the muscles of the face we're going to kind of get into a little bit. The orbicularis oculi, orbits, or orbicularis, right, surrounds the oculi. Excuse me. This muscle surrounds the orbit. You can see when this muscle contracts, this is not a muscle which is going to cause you to blink, right? That's not the function of this muscle. This muscle is going to cause you to squint, right? So let's say whatever, somebody's going to throw something at you. Somebody is going to spray you with something, right? You kind of close your eyes very tightly. You squint. That's the orbicularis oculi muscle, which is achieving that motion. Now here, same idea. Orbicularis ori, right? This is like my kids. Well, granted, they love broccoli. They're like, What don't they like? I don't know. What's a vegetable they don't like? Oh yeah, Brussels sprouts. Yeah. Trying to feed my kids Brussels sprouts. They're like, no, I'm good. They, they just kind of clench their mouth. They kind of purse their lips. They just basically kind of clench and close their mouth as tightly as possible. That's the orbicularis ori, right? Almost think about like kind of a puckering face, right? That's the orbicularis ori, which is going to perform that actual function. Now, there's a few muscles. One of the things we don't think about, there are so many muscles of the face, and a lot of them deal with kind of facial expression, right? Think of it. You don't even have to really use your words, right? My mother, she, didn't need to didn't need to say a single word, and you just knew when she was like ticked off, or you just knew like, oh man, I screwed up here, because just simply by the look on her face, right? Same thing with anybody. Just merely by the look on their face, you can tell, what their meaning is, what their feelings are. So another one of the functions of many of the muscles of the face, especially those around the cheek, those around the mouth, deal with getting our kind of cheeks and our lips in a position when we're actually chewing food, right? Which is kind of sounds a little weird, but when you chew food, right? Why is it like you don't chew on your cheek or you don't bite your lip more often? It absolutely happens, right? We chew millions of times. And out of that many times, we really don't bite our lips or our cheek that, very often. We have a 99.999 success rate, right? And why that is because there's many muscles of the face, many skeletal muscles, which actually contract and pull and keep the lips and keep the cheeks away from the teeth when we're actually chewing. Right, so one of those muscles, again, depressor labii inferioris. This muscle is going to essentially depress, again, depressor, depresses, labii inferioris. So labii lip, inferioris bottom. Oh, so it depresses the bottom lip. Right, so imagine if you were looking in the mirror and you simply just, right, you wanted to expose your bottom teeth. Right, think of that motion. That's depressor labii inferioris. Next, depressor anguli ori. Right, depressor anguli ori, same idea. Right, imagine if you were going to try to take the corners of your mouth, right, and kind of pull them downwards. Again, trying to almost think about the motion of trying to show your bottom teeth. However, that you're really trying to show like a lot, your entire bottom row of your teeth. Right, think if you're just trying to show just the front couple of your bottom teeth, that's depressor labii inferioris, right? Just the front, let's say front four teeth. Let's say you're trying to show the entire bottom row of your teeth. That's depressor anguli ori, right? Which is going to pull the bottom lip down at the angle, right? Depressor pulls, depresses anguli, the angle, ori, mouth. So it depresses the angle of the mouth. So it really exposes that entire bottom part or bottom row of teeth. Now, this muscle here, zygomatic major or zygomaticus major. Right? This muscle you can see, zygomatic. Oh, we learned about zygoma or the zygomatic bone. Yep, so this muscle is going to attach to the zygomatic bone. This muscle is going to extend upwards and attach to the zygomatic bone. Now, when you see when it comes down, how it attaches essentially to the superior portion or the superior angle of the mouth. So think of like if you were to, I don't know, if you think about like, oh man, if you got something kind of stuck, some popcorn stuck in the back part of your molars or kind of the top part of your teeth, how you kind of almost kind of pull your lips. Or let's say if you were gonna, I guess a better example, let's say if you were gonna try and show somebody like your right canine or your left canine, right, your top with those big pointy teeth that you have. Let's say, oh man, look at the size of this, top canine muscle I have on the right side. That's your zygomatic major muscle, which helps to pull that lip kind of up and open off to the side. This muscle here, this is something called genioglossus. right? Genioglossus. The glossus pertains to the tongue. This muscle is very important when it comes to actual protrusion of the tongue, right? Sticking your tongue out, right? That is the genioglossus muscle. There's some other muscles in here, styloglossus, that helps to kind of elevate the tongue, retract the tongue when we deal with, or excuse me, on this muscle actually that's highlighted here is actually styloglossus. I've actually got to change this. Sorry for the hiccup. I will update this slide a little bit later on. It's a little bit too much work right now to try and pause this and get back into it. So I will update this. This should be styloglossus. I apologize. This next muscle here, again, this is something called the buccinator or the buccinator, right? Think of making like a fish face, right? Where you're kind of almost like caving in or kind of sucking in kind of your cheeks, right? That is the buccinator, which is going to cause that to actually occur. Now this muscle, it is a little bit kind of deeper. It's a little bit hidden. There's a muscle called the masseter, which we're going to look at in just a second, that actually had to be removed, or what's called reflected, or kind of cut off in order to see that. And even a little bit of it's hidden behind the zygomaticus major, right? There's a small muscle here called rosorius. It's very small enough it can be left. However, there is a few muscles like the masseter, which we'll look at here in just a second, that had to be removed. This muscle here is something called the platysma, right? The platysma. This muscle does not do a whole heck of a lot. It does aid a little bit in kind of lymphatic drainage of the skin overlying the neck. But when we think about the function of this muscle, think about livestock, right? If we think about horses or cows or whatever it happens to be, if you see a bug or a fly land on them, if you've ever noticed their skin kind of quivers, the muscle which actually is achieving that is the platysma, right? That's how superficial this muscle actually is. Literally attaches to the skin, right? So in a number of these slides we've looked at before, whether it was for the sternocleidomastoid muscle or the elevator, the depressor labii inferioris, right? This muscle was actually removed, right? Two reasons. One, if you want to see the sternocleidomastoid, this muscle has to be removed. Really, I mean, you can see a very small part of the sternocleidomastoid here and here, right? And a little bit of it here and here, but by and large, if you want to see the sternocleidomastoid, you have to remove the platysma. And secondly, this muscle is very superficial. So oftentimes when the skin's removed, this muscle is removed along with it. This muscle here is something called the temporalis muscle. This is one of your major muscles of mastication, or one of your major muscles of chewing. This is going to elevate the mandible. Right, we see an image or a picture here, right? This is the mandibular condyle. Right, we looked at this previously. The mandibular condyle here, inserting into the mandibular fossa of a temporal bone. This is the TMJ, right, your temporomandibular joint. This is why people so very commonly kind of confuse ear pain with TMJ pain and vice versa. There's the ear, right? There's the hole where I know they say you're not supposed to stick Q-tips, but damn it, they fit so well and it just feels so good. But that right there, right, is the external auditory tube, right? The ear canal. That's where the TMJ is, right? They are less than a half of an inch apart. So sometimes it is difficult to discern which one the pain's emanating from. And we can see the temporalis, again, this major muscle of mastication, comes down and attaches to the coronoid tubercle on the mandible. And again, that's going to elevate the mandible. If you're chewing gum or whatever, chewing anything, start chewing and then just look into the mirror. Just above the ears and just above and a little bit in front of the ears, right? This is where you're going to see kind of muscles popping out of the side of your head. That's a temporalis muscle. This muscle, right? If you've ever heard of like the colloquially called the temple, right? That kind of side part of the head that people kind of massage if they have a headache. Again, there's different trigger points which can actually develop in this temporalis muscle, something called the temple. people always ask, like, oh, isn't it true, like, if you get hit hard enough with a temple, like, it can kill you? I mean, newsflash, you get hit anywhere in the head hard enough, it can kill you. The temple, not so much, is it, as far as, it's more susceptible. There's a number of places in the skull which are a little bit more susceptible. But anyways, that's where that kind of the temple, that, kind of headache generating, spot of the temple comes from. The next muscle is also a major muscle of mastication, something called the masseter or the masseter. Right? This muscle actually comes down and attaches to really the ramus as well as the angle of the mandible, and it comes up and actually attaches to the zygoma, right, or kind of the underside of the zygomatic bone. The masseter, this is also going to function to elevate, right, the mandible. When you, right, let's just say you clench your teeth, and if you kind of feel to the side of your kind of jaw, right, or even if you're looking into a mirror, when you chew food, when you look to the side of the jaw, it kind of pops out a little bit. Again, that is the masseter, which is causing that to actually happen. Another muscle here, right, of the neck, it's a little bit lower than the masseter. Again, in order to see kind of the entirety of the attachment, we had to remove a little bit of the mandible. Right, really, you probably didn't need to remove too much of it, but just this very bottom corner of it here. But here's they reflected quite a bit. This is called the scalene. There's an anterior, middle, and posterior. I don't care that you know that you can discern which one's which. Just this group is the scalene, hence the reason why up here it says 3. Just know these as the scalenes. Right, you can see the scalenes. These cords, right, these are actually the nerves which come out to form the brachial plexus. The brachial plexus, that is, if you think about any nerve in the upper extremity, any of them, they all disseminate, they all emanate, excuse me, that's the word I wanted, hey, they all come from the brachial plexus, right? And the one thing about the brachial plexus is you can see it actually comes out between the scalene muscles. This is why sometimes hypertonic or tightened scalene muscles can absolutely impact and cause different kind of sensation alterations in the upper extremity, right? Kind of pins and needles, or just kind of a feeling of kind of dullness. Sometimes even can refer pain down into the upper extremity as well.